In the field of medicine and medical ethics, there is a concept known as proportionality that plays a very important role in the ethics of medicine. Proportionality refers to the idea that actions taken should be proportionate to the situation at hand or at the moment. This means that healthcare professionals must make decisions and take actions based on the severity of the circumstances they are dealing with, ensuring that their responses are not excessive or insufficient for the given situation. Proportionality is a crucial principle in medical ethics because it helps to maintain balance between different values and principles such as autonomy or respecting a patient's rights, beneficence, or doing good for patients, non-maleficence, or avoiding harm to patients, and justice, or fairness in healthcare distribution. Let's consider a case study. Imagine that you are a doctor working in the emergency department of a hospital during a pandemic, where resources are limited due to the high demand. A patient comes in with severe symptoms due to an acute condition, but the patient also suffers from a chronic condition, which puts him at a high risk for complications if given the full treatments. In this situation, what would you do? Here you must make decisions that balance the need to provide care against the potential harm. You might decide not to administer a non-invasive treatment that could worsen their chronic condition, while at the same time treating the acute infection. By opting for a less intensive and invasive treatment, you are acting in proportionality because you are avoiding unnecessary harm and ensuring a fair distribution of resources among patients with a variety of needs. Proportionality can also play a crucial role during pandemics like COVID-19, where healthcare resources are stretched to their limits and decisions need to be made quickly. In these types of circumstances and situations, it's essential for healthcare practitioners to make decisions that balance the needs of individual patients with the limited resources. As an example, during the COVID-19 pandemic, scarce medical supplies like ventilators or personal protective equipment may need to be rationed among patients based on their clinical condition as well as their prognosis. In these cases, healthcare practitioners have to make decisions that are proportionate to the severity of each patient's situation. This means that resources should be allocated in a way that maximizes benefits for as many patients as possible while minimizing harm. Moreover, proportionality can also guide public health policies during pandemics like it did during COVID-19. For example, lockdown measures were proportionate to the spread of the disease and its potential impact on the population's health. If a community had a low infection rate and high compliance with preventive measures, less stringent or strict restrictions were enough. However, if there was a rapid increase in cases or if the disease was particularly deadly, stricter measures were necessary and therefore implemented in order to protect the public's health. In conclusion, proportionality plays an essential role in medical ethics by guiding healthcare practitioners to make decisions that are appropriate for the situation at that moment. It can help maintain balance between different values and principles, which can lead to more effective care for the patients while also respecting the patient's rights and well-being.